Good morning, everyone, and happy Wednesday. After just a slight delay, we're going to get started here this morning. Hopefully, this has gotten a couple of grins out of everybody that lets us know that we're not entirely in control of our world. We seem to experience that here at Messer, and I know Steve's grinning right now as well. So we're not gonna go through too much of a huge delay. This is a great thing for you guys today to take part in because we're not really looking at a product per se, but we're going to look at an opportunity that you have as an agent to better understand the delivery of health care and how that integrates with the Medicare policies that we write every day in our world. So without too much further ado, I'm going to introduce our good friend Steve Tilburg. Steve has been in the industry a long time, has come over to the carrier or provider side just recently, but is really excited about the opportunity. He's a South Carolina resident, so he can relate to a lot of the people attending today with what their questions may be. And we'll let him go through his presentation, and then we'll do a Q&A at the end in case you guys have any questions. What we are looking at today, ladies and gentlemen, is really understanding how the industry has moved away from fee-for-service or is being pushed to move away from fee-for-service to avoid some of the issues that pop up with that, and looking more at a coordinated care, total outcome approach for our members, our friends, our clients. So with that, Steve, I'm going to turn it over to you, and let's have a great presentation. And again, thanks to everybody for their patience as we got these technical difficulties wiped off, and let's have a great start to our show here. Go ahead, Steve.
Well, thank you very much, Jeff. I really appreciate that. And thanks to Bobby for helping me get hooked up there. I do apologize for that. Obviously, technology is what it is and sometimes doesn't cooperate all the time. But hopefully it gave you guys a little extra chance to get another cup of coffee or something on this Wednesday morning. So first, again, I just want to thank Jeff for allowing me the opportunity to present to you guys this morning. I really appreciate you guys taking the time, from your busy schedules and hopping on the call here today. So, like Jeff said, my name is Steven Tilburg. I am the broker agent relationship manager for Partners in Primary Care. I work here in our Carolina market. So again, my territory is basically going to be South Carolina, and we also have a center located just outside of Charlotte in Gastonia. You'll see we do have other markets out there, but that is my particular market there. So hopefully some of you on the call this morning have heard of us before. In fact, I think I know there are several Messer agents that we have been working with out there. So, again, if you're on the call, I want to thank you for working with us and hope that we can continue working as we move forward. But for those that are unfamiliar, I just want to, hopefully I can open your eyes a little bit to a different type of care out there that we can offer your Medicare clients out there. So just a quick little introduction about myself. Like Jeff had mentioned, I do come from the agent side as well. I recently came here as the broker relationship manager actually just back in June. So it's a newer position that we created here. It's, again, brand new. I mean, and what I do basically is I just focus on the relationship with you guys as agents, talking with the brokers. Really just kind of make sure that we really continue to get a strong relationship with you guys. I am based out of Charleston, South Carolina, like I mentioned. And again, my territory is here in South Carolina. And basically my role here is to kind of just create some awareness with the agent community in what we do. And ultimately what I want to try and do is find ways that we can engage with you and ultimately, form some partnerships that we can mutually benefit from each other moving forward. So, coming from the agent side, just about a year ago, I was kind of sitting in the same seat as you guys, and, there was a representative from Partners in Primary Care, came into my office and kind of gave a very similar type of presentation, to myself and to my agents about, what Partners does and how they can help my clients. At that time, I didn't know there was even any kind of option out there for what they do. And, I didn't know there was a different type of healthcare. So, I just remember listening to my clients for many years. There were so many that were unhappy with their doctors, whether it was they were unable, they never saw them, or maybe they felt their doctors didn't care. Maybe the doctors just weren't helping them the way they wanted to. And, here was someone that came into the office and kind of told me about a provider that claimed to address these issues that these clients had. So, so I started referring a lot of my clients to Partners in Primary Care, hoping that maybe they could provide the type of care that, that they were advertising. And what I found out is basically every single client that I had referred, they all had nothing but great things to say about us. It was all positive. It was, it was great. I mean, I was amazed by the results that, that they were coming back to me with. Everything that rep told me that day was basically validated. So, seeing the positive impact of what partners can do for our patients and your clients out there is definitely one of the reasons I decided to come here and join the organization, because I really feel we do make a pretty big difference. So from here, I just want to take a few minutes, go over our model, how we're unique, and hopefully talk about today. We'll have the same impact on you guys that it did on me when I first heard about it. So just want to kind of make sure everybody understands. So we are a primary care provider. So we're not an urgent care center. We're not any kind of specialist. We're basically, the doctor for that particular person. So as you guys are going to be going into AEP, and whether you're doing plan reviews or signing your clients up for new plans, now we would be the provider that will be listed as the PCP on your plans. So what makes us different here is, we are a senior focused model, and we also operate under what's called a value-based model. Now, in some states, specifically here in South Carolina, we are the only type of primary care facility that operates under this kind of model. So there is no other option out there if your clients are looking for what we have. Just a footprint here, we do have a presence across the nation. As we're becoming more popular with seniors, we are expanding year after year. We have some, obviously, a presence here in the Carolinas. We have a large presence in Florida. We have presence in Kansas City, Missouri, and we are expanding out to Las Vegas and to Louisiana. And also we do have a presence in Houston, Texas. I forgot to mention that. I apologize. But we are currently expanding as we're becoming more popular, and hope to do so here in this particular area. So what we had mentioned that, we are senior focused, and I just want to kind of go over a little bit by what we mean by senior focus and how it's going to give your clients that unique patient experience. So first off, we believe in a holistic approach to healthcare, and everything we do is specifically designed just for seniors. So from the very beginning, our model, it was put together so we help seniors and we address the unique challenges that they face. This was our model from day one, and it's going to continue to be our model moving forward. Each of our centers, we have board certified physicians, and they are specifically trained in treating the senior population. So they know the type of challenges that seniors face, and they address them specifically, and they're trained just for that. Every single one of these physicians, they all have many years of experience in the medical field. Some come from private practices, some come from more organized type of facilities, but every single one of them are extremely experienced and all have a proven history of helping patients. So you can assure that the doctors you see, your clients are not going to find more qualified doctors out there. So to help ensure that we focus on seniors, obviously, what we do, we accept patients that are on Medicare Advantage plans. And that's the only kind of plan that we do accept right now. We are payer agnostic, so we do accept multiple plans. Currently in the Carolina market, the plans we accept are Humana, Aetna, Cigna, and WellCare. We are looking to expand on those plans as we move forward. We have some new contracts coming out in 2021, which we will be offering some more plans out there. So again, it's not where we have one particular plan. We have a variety of plans. We try to cater to as many of your clients as we possibly can. So I mentioned before, we believe in a holistic approach to healthcare. So every single one of our centers, what we do, we have an on-site coordinated care team. And what they do is that they work together to address every type of senior concern out there. And I'm going to touch a little bit more about how that care team works in a little bit. But I also want to talk about our centers specifically. So when they are built, they are specifically designed to make sure that they outfit and accommodate seniors. So what we do, we have wider doors, we have wider hallways, we have non-slip floors that obviously will help prevent any kind of accidents in there. The exam chairs that we have, they're built so that they lower and raise so they can accommodate any type of mobility issues that our seniors face. And what we also try to do is we offer all types of services in-house. So what we try to do is make it a one-stop shop for the seniors, so they don't have to make additional appointments or go into different doctor's offices. So what we try to do, we do all diagnostics, we do all of our labs, we do infusions, any shots or immunizations, they're all done on site. Some of our centers, we actually have X-ray machines that are done so we can do some more advanced imaging type things on site. And we actually even have pharmacies that are located right off the lobby as well. So when they need their medications, they can get them right there and then as well. So what's also pretty cool about our centers too is that, in each center we have an activity and a community room that's attached to each center. And what these are really kind of large scale rooms that are used for many type of activities to help support the patients that come in there. We can offer them free health classes, fitness classes. We host games and wellness activities. It kind of gives our patients a chance to, socialize with other members in the community and, not just cater to their health, have some more social type things that help their well-being as well. We host educational seminars. We have classes that can cover various topics that seniors are concerned about, whether it be, stuff about conditions specifically or just maybe, type of senior events. We host a lot of these activities in our center, but as you see, these are all kind of activities that agents yourselves, we want you guys to be a part of that, and we'll talk about how we can do that in a little bit as well. So the other part of our model, which makes us unique, and what that is the fact that we follow a value-based care model. This model is very different from what most people have been used to. Most are used to your traditional fee-for-service. We're different than that. I'm going to touch on a couple ways on how we are different there. So the whole concept of a value-based care model is that we take a proactive approach to keep and make sure that your patients stay healthy before they get sick. All right, our motivation is to make sure we keep our patients out of the hospital, the emergency room. We want to decrease the chances that they're going to need any kind of advanced level of care. And again, just going to kind of explain why that's important to us. So in a fee-for-service model, what most people experience there, the providers, they're compensated on the volume of patients they see. They're compensated on how many procedures they order. And what that does, it really encourages these providers to see as many patients as they can, so they can in turn, get greater compensation. So obviously the more patients they see, the more money they make. So, what that does, it kind of leads to a little more of impersonal type of experience for the patients. The patients don't feel they have that special type of attention because they're kind of just like a number to their doctors. So the value-based care model, that works just the opposite. Okay, our providers, our compensation is based on keeping patients healthy and keeping them out of the hospital, keeping them out of the emergency rooms. Okay, and the reason we do that is because we operate under our risk contracts with our health plans. And for those of you who don't understand what those are, pretty much how these contracts work is, with our health plans, we basically, ourselves, partners in primary care, we take on the financial risk where if our patients do not stay healthy, we're liable for those medical costs. Okay, if our patient needs to go to the ER or gets admitted to the hospital, we have to pay those costs. Okay, where on the other hand, if our patient, if we keep them healthy and they don't have to go to the hospital, they don't need any kind of advanced care, any profits that we take in from these premiums of healthcare, we keep 100% of the profits. So basically, it's our best interest, just as it is for the patient's interest, to try and keep them as healthy as possible. So again, that's pretty much why we focus on preventative care, long-term wellness, and again, we want to focus on a level of care that doesn't necessarily mean that we see people when they are sick. It's we see them because we want to prevent them from getting sick. Okay. And again, a lot of what we do as well, we have a coordinated care system, so we don't have one doctor that's looking after our patients there. We have that integrated support team that all works together and caters towards that patient's needs. And what it does, again, it gives the patients a better experience, it gives them lower costs, and it's going to ultimately give them a better overall health. So, let's talk about that coordinated care team a little bit. I want to kind of show you how that works and what they do and, how they address the patients to give them the best level of care out there. So the care team is structured so that it really supports the relationship between the patient and the physician. In addition to, your nurse practitioners out there, your physician assistants that most people are used to, we also have a social worker, we have a behavioral health specialist, a pharmacist, personal care coach. All of these people are there on scene in every single one of our centers, and they work together to make sure that they can address any factor that could have a detrimental effect on a senior's health that they can address. Sometimes it might not just be a physical health that's affecting, the patient. It could be a social issue, a behavioral issue, financial issue. We have someone there to address any kind of issue that might be at hand. And, in the center of this as well, we have our center administrators. what they do is they kind of work as a quarterback of our centers. They make sure everybody kind of works in collaboration so that they ensure everybody knows every bit of information on each patient out there. So kind of how they do this, we do every single day is what's called our morning huddles. And when I witnessed this firsthand, I thought it was a great concept. I've never seen something like this before, as far as how people coordinate to make sure they really show proper attention to their patients. So what they do every single morning, each care team member that I had mentioned, they gather together in this morning huddle, and they talk about every single patient that's scheduled to come in for a visit that day. So any bit of information that they have regarding that patient, they discuss it, and each team member is going to go there and give some input on how that they can go and help that patient. For example, I mean, with our social worker, we may find out that they might need different ways to help their social wellness. I mean, they might have some financial problems where they need assistance with food stamps or different kind of medication assistance. That's when our social worker is going to step in and basically offer some kind of input to help that patient in that particular aspect. A clinical pharmacist, again, what they can do, they can discuss the medications that the patient may be on. If the patient's not taking the medication, they may not like it, they may not like the side effects. They're going to provide the insight on, maybe a different or alternative medication, offer guidance on what can be, again, a better, different alternative, and just go over, different safe usages of, on how to use those medications. And again, similarly, down the line, behavioral health specialists, they can help coordinate care solutions for any kind of mental, behavioral, psychosocial issues that they may be encountering. We also have referral coordinators. This is also part of the care team. What they do basically is if we do come across a patient that does need some kind of advanced care, what this referral coordinator is going to do is that they're going to recommend, top tier specialists that work perfectly within whatever kind of health plan that they're on, so that if they need to transition into a different office for that care, it's going to fit that plan perfect, and it's going to be someone who is obviously, a very top quality specialist to give them the best type of care. And then we have our care coaches. Our care coaches, what they're going to do, they're going to educate all of our patients on any kind of health conditions that they may have. They're going to discuss the treatment plans with them, basically make sure that they take an active role in the patient's health, so that not only are they doing the right thing and taking the advice from the doctors, but they really understand, why we're giving them that treatment. What are the things that we're doing to help them be healthy moving forward. So basically, what does this do how does this help our patients? So one of the things it does is that it's going to make sure that they're going to have a lot more time with the doctor. So, being the fact seniors have more complex and chronic conditions than most people, we want to make sure that they have access to longer appointments so that we can address anything that they might be managing. So if you're coming across patients that say they don't have, the doctor doesn't have time for them, on average, our appointments run 30 to 45 minutes. So, it's going to be tough for patients to say that their doctor doesn't have time to spend with them. I mean, we solve that issue right there. So in addition, we also have a high touch model. So what that means is, we try to see them about 6 or 8 times per year. With seniors, as I'm sure we all know, I mean, their health can deteriorate a lot quicker than most. So we try to see them more often, and we try to stay on top of their health a little bit more, because we don't want something to develop and obviously progress a heck of a lot quicker. I mean, we want to be on top of it. And again, by doing this is just another way that we can really help keep them out of the hospital and have any kind of unwanted ER visits down the road. So, yeah, I'm sure you can understand. I mean, our patients here, they're our top priority. And again, we want to make sure that we are as accessible to them and that we can be as accommodating as possible. And one of the ways that we also do that is, our panels at each center, we max out anywhere from 500 to 750 patients per center. So what that does basically is that we want to make sure that we are going to have a doctor that has a ratio that can ensure that they're going to be able to be there when they have any kind of need for any kind of care moving forward. This little graph here or chart here, it kind of walks through how we integrate our patients into our centers, and shows how accessible that we try to be for them. So what we try to do, we first schedule our welcome visit. This is usually done within a week of when a patient expresses some interest on working with Partners in Primary Care and becoming a patient with us. We try to schedule this basically on the patient's preference when it's a good time for them. We invite them into our centers. This way they can meet the doctors, they can meet the care team, obviously see the centers as well. But if needed, we can also do this via video or phone if necessary. They might not be too apt on going into a center right off the get-go, so we can take some other accommodations to make sure that we give them the information that they need. So then as they decide to sign up and come out as a new patient, then we're able to basically schedule their first visual visit, and we try to do this within 2 weeks. And this is where they actually come in and meet with the physician, just like getting their regular checkup, and they meet the care team, and we kind of dig in a little deeper about any kind of issues they have. Again, just like a regular doctor visit. If we do determine that they do need to come in sooner than that 2 weeks, obviously we can accommodate that sooner if need be. As they're established as patients, then all appointments that we offer them, we make sure that they will be available within 2 days. If depending on what kind of visit it is, we can also do, obviously in-person or in-office visits, but we can still offer any kind of video or telemedicine visits if that's more convenient for them as well. And again, being the fact that we keep our panel small, if there is an urgent need, even though we're not an urgent care center, we can make a same-day appointment needed if they do have that special type of care that they need to be addressed. So as if a patient does get referred to a specialist, if they do need to see a cardiologist or a pulmonologist, whatever it might be, we make sure that we can see that specialist as soon as the same day if needed, if there's some type of urgent need there. But it's never going to be more than 1 week out from when they get referred to that particular specialist. So again, we try to make sure that we get them quick care. They're not waiting for week after week to get that care they need. I mean, as patients develop things, they want to see their doctor, sooner than later, and that's what we accommodate here for. And if they do happen to see this, have to see a specialist, any follow-ups, we make sure that we get them information within 48 hours of getting results from that specialist. So again, accommodating them, making it convenient is really our goal to make sure that they get that quick, attentive care that a lot of people are missing these days. So just want to touch a little bit about COVID. Obviously, COVID is a pretty important factor in everybody's daily lives these days. And I just want to touch on what we're doing to kind of to accommodate our patients, during this current state that we're going through. So first off, we are not turning patients away. We've actually heard in some instances where some providers aren't seeing new patients, or they're not seeing as many patients due to different concerns out there. And we've been doing just the opposite. So if every staff member, as they come into our center right now, they are screened every single day. We're using personal protective equipment. Obviously, masks are mandatory. So we're making sure, obviously, that if the staff member is going into the center themselves, that they themselves, would not serve as any kind of possible risk to our patients. And as for the patients themselves, same thing. We're making sure every patient coming in is also screened. The temperature checks, the masks. We have masks available if they don't have them. We have hand sanitizers. We will provide them with personal protective equipment as well if need be. If they are symptomatic, we do have alternative ways to bring them into our centers. So rather than come right into the lobby of the center, we have alternative ways that we can escort them into exam rooms so they don't walk through the waiting room or any common areas, or risk any kind of exposure issues for either themselves or the other patients that might be a little nervous sitting in the waiting rooms. In addition, our furniture, we've obviously rearranged them to provide for proper social distancing, so people aren't sitting close to each other. We be sure to disinfect our high traffic areas multiple times a day. This includes the waiting room. It includes obviously the exam rooms. We make sure that there's it's 100% clean based on the CDC standards out there, and that we abide by that. So for some patients, they are still apprehensive for coming into the centers. So I think I mentioned earlier, we are offering telemedicine visits and video calls. This allows them to still get that care from our doctor while avoiding any kind of concerns for getting out in public. And then what we can do is address that issue, and then also the doctor and patient, they can then decide, when's the right time for them to return to an in-person visit later on down the road. So on this next page here, these are just some of the resources that we give our patients. It just kind of serves as a trustworthy information resource that they can use regarding COVID. There's resources online on our website where we have flyers about information regarding if it's food and mental health mental health resources if need be. We actually have an online risk assessment tool where patients can determine if they have certain symptoms. Is it possibly a COVID diagnosis? They can use that tool for maybe doing a self-diagnosis there. And we also have a portal on our site that gives patients access to informational videos and other types of helpful videos on how they can adapt to different technologies that needs to be used in these days. People aren't seeing each other in person, so any kind of appointments they have, they need to rely on technology. So we kind of help them really adapt to the technology out there, and so that they can better engage themselves into certain things that is important to them. So let's talk about, obviously, working with you guys, the agents now. I mean, how can we help you? Obviously, you guys are very important to us, or I wouldn't be talking to you guys right now. I mean, a good portion of our patient growth, it comes from referrals from you guys, and you guys telling your clients about, who we are and what we do. The exact reason I'm speaking to you is, I need you guys to keep, talking to your clients, telling them what we do. We still need those referrals out there. My goal is to hopefully, like it was when I was an agent, you guys can see the value that we bring, and you'll be excited to tell your clients about what we can do, especially knowing if it's going to help them. I mean, obviously, I think we're all here to help our agents. Let them know about us. That is definitely a good point on how you can help them moving forward. But let's just take a look at a few ways on how referring us can help you guys as an agent, and some ideas on how we can work together as well. So one way that we can help you is when if you send a client to us, first of all, you're going to make them happy. I mean, you're doing a service for your client. Just as as I received the feedback from my clients when I referred them when I was an agent. I know that I gave them a solution that addressed the concerns that they have when it came to their frustration with healthcare. They're going to be less likely to switch physicians. They're going to be less likely to switch health plans from year to year. It's going to make your job easier. It's going to help with your retention with your clients. And trust me on this, you will get more referrals as well. When you sign up a client for a good health plan, that's obviously a great thing. But when you can combine it with a great primary care provider and an actual good experience with a doctor, you will see that they will tell their friends and they will tell their family about what you helped them with and how you referred them over there. They're going to be grateful for that. And like I said, I mean, I've received so much feedback from agents, and and they were surprised about how many referrals that they have got just for that reason. So it's definitely something important to think about there. With our particular model, just some numbers here to show you that it does work for your patients. We've shown a 34% increase in treatment of undiagnosed conditions. So by coming to us, we're a lot more proactive in trying to make sure that we dive pretty deep into your client's health. So a lot of those patients wouldn't have even known they had an issue if they had not come to us. When it comes to patient experience reports out there, there's a lot of surveys out there that measure how satisfied patients are, and we're among the top there. So we have a star score of 4.21, and our NPS rating is at 81.2%, which is, again, it's among the highest of the healthcare providers that are out there. So again, these are just a couple things, some text messages and stuff that we get from our team here about how happy that our clients are with working with us. It's all positive stuff. So, trust me when I say this, your clients will love us if you send them our way. So these are some of the ways that we can partner together to kind of, give you guys opportunities to grow your book of business as well. So, I mentioned earlier that each of our centers, we have an activity room attached, to every single location that we have. So on the left here, these are just, a couple pics of some of the rooms that we have, so you can see the size and the scale of, our capability of bringing people in there to utilize these rooms. But we want to, engage you agents and have you guys come to these centers to basically join with our patients and bring your clients in there so that we can work together to help you guys out. So one of the opportunities that we do right now, it's pretty popular. It's called our Agent of the Day program. Some of you, again, may be familiar with that. And what the Agent of the Day program is, it's an opportunity for you guys to sign up and basically be the dedicated agent where someone in our center has a question regarding their Medicare or their health plan. We're going to send them over to you so that you can be, that solution for any kind of questions that they do have. Typically, we love to do this in person. We have a dedicated office for you agents just to sit in. So again, we can put them into the office with you. We even allow you to bring your clients in there, and you can run appointments if you like. Again, utilize our facilities. However you want to utilize these offices while you're on that particular day, we want to support you there. But unfortunately, right now with COVID going on, we are doing this virtual. But the concept is basically still the same thing. So instead of coming in there in person, what we're doing is any agents that are participating in this, they're providing a headshot of themselves. If they're working with an agency, obviously we can put your agency logo on there, and we print out a flyer that's given to the front desk. And as a patient comes into the center and has a question, if they need an agent to speak to, we're going to provide them with a flyer. So they'll have your contact information on there, they'll have your phone number, email, and basically for that 24-hour period, you are the dedicated agent that they would be calling if they have any questions. So again, it's a good opportunity to really build relationships with people that have questions, and really be a resource to people that come through our centers. So one of the things I do want to touch on real quick is obviously agent of record. So we have heard a lot of concerns, now being the fact that we do have this agent of the day program. Some agents are a little reluctant about maybe referring somebody to our centers because obviously there's an agent sitting there, and they run the risk of possibly having that agent, take that client away from them. So one of the things that we do, and it's my prime responsibility, is we have procedure set up where we protect the agent of record for anybody that comes in there. Okay, so depending on the patient's knowledge of, we ask them who they're, if they have a question, do you have an agent that you're working with? If they do, okay, well then you need to go talk to your agent, because again, that's your agent, that's his responsibility. As much as we would love our agent of the day to express some help there, we're not going to run that risk of having them form a new relationship and then lose that first connection with their original agent. We do have a lot of software in our, depending on what health plan we work with, where we can actually look and see who their agent is. So again, if they go to our front desk and have a question, we can actually find out who their agent is, and then we can go and direct them to that agent. But for the most part, there is a good chunk of patients that do come in there. They don't know who their agent is, or they haven't talked to their agent in years. These are the people that you're going to be able to go there and talk with. And again, if it's some of the people that are on the call here associated with it, a lot of the agents do have a pretty large book of business just from people coming into our centers here. So it's a great opportunity for you guys to help build your book of business there as well. So what we also do, we also host educational programming in our centers. Again, these can be health-related topics like diabetes management, something whether it's cardiac issue, or maybe even something that's non-health related. Something like the importance of putting a will in place, or just again senior concerns. We can bring people in there and just hold classes to give them a lot of information that's really going to help them. What we try to do is we love to have agents host these classes. So as we're talking about these topics with with our patients, you guys are in the forefront. You're in front of these these groups of people, and you're providing that information for them. It gives you another opportunity to meet some potential clients out there. And even if it's not something for our patients, we want you to invite your clients in there, or any prospects you might have. You guys can use these rooms for annual benefit reviews. You can invite people in for Medicare Advantage, formal sales events, any kind of community engagement that you might be doing. Use our facilities. I mean, that's what we want you to guys. We want you to use these. Gives you a chance to have larger scale audiences. We help you guys by providing light snacks in there for you, so we kind of help support any kind of issues like that when it comes to gathering people together, that you want to speak to in a larger group. We also have an activity coordinator, and what she does, she puts together various types of healthcare training for our patients. So it could be Medicare 101 classes, it could be silver sneakers classes, any kind of specific plans like that. Again, we try to get a scheduled calendar going on, so we have at least 1 or 2 of these going on in each center per day. And again, something for you guys to get involved in. You agents can get in front of these classes, give a quick presentation. The more and more you get involved in these centers, you kind of become a familiar face, and again, you can be the go-to guy or go-to girl that, that they're going to want to come to when they have questions. It's going to lead to more referrals, more questions. It's going to be a great opportunity for you guys to get in front of a lot of people there. And there's also, some of you out there, that you do spend money on, marketing yourselves. Sometimes it could be through direct mail. Sometimes it could be, sponsoring an event. It could be, media exposure, whether it's, through the radio or through the TV. There's community events out there. These are things, again, we want to partner with you guys, and pretty much help, it can be a financial, sharing in the cost of the events, just partnering with you, and, not only will be able to, associate yourselves with us, which again, could be a great option for your clients. It's going to help you, bring more clientele in there. We can have our patients involved there. We can help in the promotions of these campaigns. And again, a bigger part of it is, the sharing the cost right there. So, we are always looking for new and innovating ways to partner together with you agents out there. So just to kind of touch on COVID a little bit here, I had mentioned right now, we are not allowing agents into our centers, and we're very limited with our activities going in the centers right now. But COVID has actually given us a pretty good chance to test the effectiveness on how we can reach our patients virtually. So as I'm sure a lot of you agents are seeing out there, virtual is kind of the way to go. I mean, a lot of people aren't seeing people face to face anymore, and we really have no other way to reach out to them. And, what we've been seeing so far is, we've been pretty successful in getting our senior clients more engaged in these virtual events. We've done a lot of things with other agencies out there promoting Facebook Live events. We've done Zoom meetings. We've done, a lot of these activities that we do in our centers where we would like to do them in person. We're just doing it on a virtual platform. And again, we've had some pretty good success with it. And again, what's great about virtual is that you can host these events from anywhere. So you don't have to come into our centers. We can get you linked up just kind of how we are right now, and you would be the host that would be, getting engaged with our clients. One of the, like simple things that we've done, we do a virtual bingo that we do every week. It kind of started out slow where we would have an agent come in there and they would call numbers. Again, it was kind of small attendance at first, but as we're doing it week after week and we're getting more exposure on Facebook and getting the word out more, we've actually got quite a big audience right now. And, the agents are having a really good time, calling the numbers, making it a fun project. And again, getting them more exposure to kind of get in there. So, I mentioned, what we want to try and do is, get you to tell your clients about us. And one of the best ways that we can do that is to kind of put them in contact with either myself. We have a community engagement reps, which we'll talk on in a couple of minutes. And what we would love to do is to see if we can get your clients to take a tour of our centers. We have a VIP tour pass that we can provide to you guys. You can give them to your clients. There's actually a campaign that we have that is going on right now where if you give them a tour pass, there's an incentive on there where if they come into our center, whether it's in person or we do virtual centers, that they're going to get a gift card just for taking a tour of our centers. So again, some really good campaigns and opportunities for your clients to take a look at there, and we give them a little thank you for obviously expressing some interest there. I did mention the virtual tours, our website, which is www.partnersinprimarycare.com. That's where you can access virtual tours. Every single center that we have would be listed on there based on location. And again, you can view these online and get a good idea as far as what we can do, for your clients and how our centers are designed. Also on these centers, on the webpage, there's some great YouTube videos of some patient testimonies. There's our providers that are talking about what they can do for your patients. It just really gives a little more of an in-depth idea of what we can do to serve as a unique model for your clients. So, again, we'd love to have it done in person. We are accepting patients to come in to do an in-center tour right now. So if they want to physically come into the center, patients are more than welcome. Agents, unfortunately, are a little, again, we're erring on the side of caution. So our medical directors are asking that agents do not come in to do tours right now. We are working on some smaller scale agent gatherings that we can do after hours, which, I can always talk to you about later on down the road if you're interested. But, if you guys want to take a look at the centers right now, again, doing these virtual tours are going to be probably your best bet. And then hopefully soon, as the COVID numbers can continue to drop a little bit, things will change, and obviously we want to get you guys into the center as well. But in the meantime, check out our website, take a look at some of the tools that we have for you, and just check out some of these virtual tours. So that VIP pass I was telling you about, this is just a quick sample of what we can provide to you. This one is not a copy of the one that has the gift card incentive on there, but again, it's just something that you can give to your clients. It will have an actual clinic location, the address on there if need be, contact information so that they can call and coordinate it. Again, sometimes giving your clients a VIP tour pass, it just kind of makes them feel a little more special, I guess, that we're giving them that special white glove treatment as they come into our centers. All right. On our website, like I said, we have an entire agent portal that's dedicated just to agents. So what that's going to do, it's going to give you access to guides, about how you can have conversations to your clients about Partners in Primary Care. It'll give you some PDFs or some flyers that you can either print out or mail to your clients. I can provide you with these as well. So if you have any resources that you want actual physical copies of, you can reach out to me and I can make sure that we get you these tools and marketing templates that can help you guys out there. So I mentioned earlier a little bit about our community engagement team and what these people are. So each center, like I mentioned, it's each unique location. And each center, there's going to be a community engagement rep that is basically going to be the liaison for that particular center and for any patients coming in or any information that the agents want to get from Partners in Primary Care. These are the people that are going to coordinate any kind of activities that the agents want to include themselves in. They're going to arrange any kind of tours for either yourselves or for your clients as there's interest there. They're basically going to be your point of contact in assisting you with any kind of engagement that you have going on with partners. So, again, whether it's going to be developing some of those co-branding marketing campaigns, I'm here to kind of put those together for you, but they're going to kind of walk you through the process and make sure that it's getting done properly. They're great resources for you. They're trained to not only take care of the patients, but obviously support you agents as well. And, hopefully you'll get a chance to develop some good relationships with them. This is just a list of the people here in the Carolina market. Again, so we have 10 centers here in the Carolina market. There's probably some on the call that are outside the market, so this may not apply to you. But again, we have 10 centers and we have 5 representatives. So each representative is assigned to 2 different centers, obviously based on the location of where those centers are. We can always get you this information out to have them be a point of contact for you. So at the end of this, you can always reach out to me and I can put you in contact with these people. So again, here in the Carolina market, we do have 2 locations that are located in the Charleston area, which is where I'm based out of. We have one in North Charleston, which is located on Remount Road, just off Interstate 526. And then we have one in the West Ashley area, which is on Sam Rittenberg, kind of right in the triangle where all of the major highways meet. The 7 locations in the Upstate. So we have 2 locations that are in Anderson. The Homeland Park location is actually attached to a Walgreens. So again, there's a center attached right there within that facility. So there's a lot of walk-in traffic area as well. Again, same thing. It has a activity center in there, has the agent of the day. So there's a lot more opportunity to get some exposure there. Then we also have 2 in the Greenville area, 1 in Seneca, 1 in Greer, and 1 in Spartanburg. And, we also have that 1 location that's up in Gastonia, just outside of Charlotte. I don't have that listed on here. But again, that's about another half hour north of Spartanburg there. So with that, again, I just want to thank you guys for taking the time. I do apologize if I got off to a shaky start here. But if anybody is interested in, partnering with us or learning more about, how we can work together, or just simply they just want to get more information that they can provide their clients because they think this is a great model for them. Again, this is my contact information. That's my cell phone number. You can call me there. You can text me at any time or email me. Any way I'm accessible in any one of those, contact means there. So again, you want to be part of the agent of the day, anything, please reach out to me. I would love to get you some more information, talk to you more on a one-on-one type of context just to get more information or even put you in contact with one of our community engagement reps. I just want to do whatever I can possibly do to kind of help get you guys engaged and, again, help develop some good relationships moving forward. So with that, again, I thank you so much for your time, everybody. And again, we can move on to the Q&A portion if anybody has any questions.
Yeah, we've got just a couple things. People were asking about possible expansion in the near future in North Carolina. Can you touch on that, or do you have any information about what we may see since South Carolina and North Carolina operate in conjunction with each other, especially in the Charlotte, Gastonia area?
Sure, absolutely. So right now, we do have a dedicated team that is looking for expansion here in the Carolina market. I am actually not on that team, so I don't have the exact information on that, nor I don't think are we really allowed to talk about it. But yeah, we are talking about expanding here in the Carolina market. I mean, we've been talking about areas as far as, again, up in the Charlotte area, different parts of North Carolina, maybe reaching out to the Atlanta area, as well as, some of the main parts here in South Carolina, whether it be Columbia, up in Myrtle Beach, Bluffton. We're looking to find where we can find the best demographic that would obviously have the biggest need for our type of care. So we have a special team that is working with the CMC to kind of look at some statistics out there, but we definitely plan on expanding in the very near future.
Great. And Steve, in your experience as an agent and helping these guys out when they're doing their applications and they're trying to fill in a primary care position, what would they need to put if they want to use a partners in primary care location, but they're not quite sure of a particular physician's name? How would we handle that on the application?
So in all the doctor databases, we are listed either generally as partners in primary care, the actual name of itself based on the location, or we also have flyers that we can provide to you guys. And what it does, it has a list of the physicians located at each location. So you can search by physician name as well. Again, I'd love the opportunity to email you over the PDFs that have the list of the doctors involved so that they can search for it either way.
Yeah, that'd be great. And just so everybody knows, for those of you that did attend, whatever slides Steve can share with us, we'll get those out to you in an email, as we always try to do with any of our presenters, so that you've got this information as a little thank you on our behalf for taking the time to attend. I as well want to apologize for the little bit of a technical glitch this morning, but again, I think it's a great thing to remind us that we don't have the control that we always think we do over our worlds. And we look forward to seeing what takes place as we figure out this fall and the open enrollment season and moving forward with this new combatant COVID and how that will affect. Steve, you mentioned right now that agents don't necessarily need to try to take a tour. Members or possible members are welcome to do so. Do you foresee that changing in the near future, or should we just stick with virtuals for now? And then the process for those agents that are working with Messer, they would want to coordinate that contact between you and myself, correct?
Yeah, I mean, we could do it that way. And we do see some changes coming up in the foreseeable future. I mean, we have had some special circumstances where we are allowing agents to come on scene, but it's really at the discretion of our medical director. We are looking to put some plans into place. So my national director, what we want to try and do is put together opportunities where if you guys do want to come into our centers, it may be after hours, or it may be only on certain days that are dedicated when the centers are prepared to have somebody come in there. But yeah, I mean, whether it be a tour, we want to host certain kind of, thank you events. So for people that are looking to partner with us, it might be, some light snacks, having you guys come in here and, maybe doing some group tours or so forth. And as we get that information, we're definitely going to get that out there. But we are working on a lot of different ideas to get you guys engaged in our centers. And again, not just in a tour capacity. We also want to make sure that, again, if you want to host sales events or something like that, we're trying to work with, having you guys come in on, dedicated dates for certain hour blocks where you can invite people in there to do, a presentation during AEP, maybe collaborating with some mailings out there to kind of promote it as well. So, things are changing, thankfully. It looks like they are easing up. I wish I had more control. If it was up to me, I'd have you guys come in there as soon as today, if possible. But obviously the medical directors are the ones calling the shots and keeping things safe. So again, any interest that we have, keep me in mind. I'll keep you in the queue. And as things do change, we'll set things up as soon as we possibly can.
All right. And Steve, do you guys, as we get into September, October, what type of marketing are you guys doing to get the names of partners in primary care out there more into the community so it becomes something that's better known? What type of activities are you guys engaged in as an organization at this point?
Well, we have an entire marketing team right now, obviously. So right now we are engaging still a lot of the virtual activities. So we're doing a lot more television commercials, some radio ads. There's some talks about doing some billboards. And again, that's just some general advertisements to get some word out there. But we also have, a lot of direct mail campaigns. We do partner with some of the health plans out there where we do some co-branding marketing events. Or not events, but, marketing mailers that go to a certain proximity of, maybe a 5 to 10 mile radius outside of our centers, showing them that, we work with this particular provider, or we can even do it with an agent. Again, we try to target the ideal demographic that would fit our model, which is, typically anyone from 64 to 68 years old, again, within close proximity of our centers. And, as we advertise and let them be a little more aware of what we do, obviously the closer they are to the centers, I think that's the most success we're going to have as far as bringing those people into the centers, being the fact it'll be in close proximity and it's a different kind of model.
Great. And you mentioned that you guys are currently working with Humana, Aetna, Cigna, and WellCare. Do you foresee any additional carriers coming on? I know you may not be able to mention names right now, but should we be looking for some big announcements here between now and October? And if an agent, go ahead.
Yeah, I was going to say, yeah. So, like I said, we do have a whole dedicated team that works with the health plans out there and, trying to add some coming on for future years. There is one we are 100% positive they are adding for us next year. Again, I'm not allowed to discuss that right now. But yeah, we are going to be adding as soon as 2021 some new health plans that will be accepted in our centers here, and we will definitely make some announcements as soon as that comes out.
Great. Well, I'm gonna close out today's meeting. Just want to thank everyone again for their time and their patience as we kick this thing off this morning. Thanks, Steve, for his patience and getting his computer restarted for us. Again, those technical glitches sometimes happen at the most inopportune moments. But if we can't laugh at ourselves a little bit, then we need to maybe take ourselves a little less serious. So I want the agents to understand that this is a great tool for them to have in their bag, along with the carriers that you represent. This may be the type of facility that will make an unbelievable difference in one of your members' lives. So please keep that in your thoughts when you're doing your presentations or answering questions outside of an appointment with your clients. And keep this, again, in the idea that this is a facility or facilities within the state of South Carolina and North Carolina that do offer the model of care that we are being moved toward, which provides a lot better outcomes in almost all cases for the members. I think some people, and I don't want to provide too much lenience toward another carrier, but if you'll recall, Cigna Health Spring is one of the first that came out with this coordinated care model and was willing to push this model, and we saw a lot of success with them. So to see a primary care provider adopt the same type of philosophy, it's a good thing, and hopefully you guys will again add that to your conversation points in your appointments. If you have any questions about this presentation today, again, Steve will be providing some slides for us to send out to you. Please give us a call here at the office and we can coordinate some conversations and hopefully get you guys engaged with the offices that are closest to your working areas. And then as these guys expand, which we foresee them doing as the model of care continues to change and advance, we'll want to make sure that we're in there on those ground level opportunities. So with that, everybody have a great rest of your week. I want to thank Partners in Primary Care for their partnership, and all of you out there for your trust and loyalty in Messer Financial Group. We look forward to seeing you soon in person and hope you guys have a safe rest of your week. Thanks, everybody, and take care. Thanks, Steve.
Thank you, guys. Appreciate it, Jeff. Thanks.